I worked with thousands of men over more than 15 years of clinical practice, and most of them were terrified to even acknowledge what they were doing behind closed doors. They wouldn't dare ask their doctor if it was safe, if it was damaging them, or if it was slowly destroying their prostate from the inside out. I'm Dr. Natalia Parker, and I'm going to explain this with clarity because there's something happening to your prostate right now. Something most men your age are doing regularly, but nobody wants to talk about. And the silence around this topic has created a dangerous gap filled with myths, fear, and misinformation that could be affecting your health in ways you can't even see yet. You've probably heard the rumors, maybe from a friend at the gym, maybe from some random website you stumbled across late at night, that frequent ejaculation irritates the prostate, that it causes inflammation, that it might even increase your cancer risk. And now every time you masturbate, there's that nagging voice in the back of your head asking, "Am I hurting myself?" But here's what nobody tells you. That voice, that fear, that shame you're carrying, it's based on something that isn't even true. Let me tell you about 3 silent fears that men over 60 carry but never speak out loud. The first fear is the one about damage. You wake up multiple times at night to urinate. You feel like you can't fully empty your bladder, and deep down you're wondering, is this just age, or did I cause this? Is masturbation making these symptoms worse? The second fear is even more personal. You compare your sexual function now to what it was a few years ago. Maybe it takes longer to get an erection. Maybe ejaculation doesn't happen as easily. And that thought creeps in. Did I overdo it? Did I damage something permanently by masturbating too much throughout my life? The third fear is the one that keeps men silent. The fear that if you ask about this, if you admit you're still sexually active at your age, someone will judge you. That your doctor will look at you differently. That you'll be seen as inappropriate or perverted. These fears are destroying quality of life for millions of men. And here's the tragedy. Most men will never talk about this with anyone. Not their wives, not their friends, definitely not their doctors. But what if I told you that one of the largest studies ever conducted on this topic found something completely opposite to what you've been fearing? When I first read the Harvard study years ago, I was stunned. Not because it presented wild or unfounded information, but because the data was so clear, so well documented, that I immediately thought, why isn't anyone talking about this? Why isn't this information reaching the men who need it most? The study was published in European Urology, one of the most respected medical journals in the world. Not some random blog, not a questionable theory. Real science, peer-reviewed, with rigorous methodology. The researchers followed approximately 32,000 men over 18 years. Yes, 18 years of tracking. And what did they discover? Men who ejaculated 21 or more times per month had up to 33% lower risk of developing prostate cancer compared to men who ejaculated only 4 to 7 times per month. Let me say that again because this is critical. 33% lower risk, 1/3 less chance of developing a disease that affects so many men after 60. But you're probably thinking, Dr. Parker, how is this even possible? How can masturbation actually protect the prostate? And that's an excellent question that deserves a complete answer. The explanation has to do with how your prostate naturally functions. This walnut-sized gland, located just below your bladder, produces part of your seminal fluid. And during this production process, potentially irritating or even cancerous substances can accumulate inside the prostate. Think about it like this. Your prostate is a factory that's always producing, and every factory needs to flush out its production, right? When you ejaculate frequently, you're essentially doing a regular cleanse of your prostate. You're eliminating these substances before they can cause problems. But there's more to it. Frequent ejaculation helps maintain blood circulation in the pelvic region, and good circulation means more oxygen and nutrients reaching your prostate, which contributes to keeping it healthy. Plus, regular ejaculation keeps the muscles in the pelvic region active and strong. It's like exercise for any other part of your body. If you don't use it, you lose it, and this applies to the muscles that control erection and ejaculation too. Now I know you're thinking, okay, Dr. Parker, but does this apply to all ages? What's the ideal frequency for my age specifically? This is one of the most common questions I get in my practice, and it's completely valid because your body's needs and capabilities do change with age. For men in their 40s, libido is usually still high, and ejaculating 21 times a month or even more is perfectly normal and healthy. In fact, many men in this age range ejaculate far more frequently than that, whether through sex or masturbation. That's completely fine. When we get to the 50 to 60 age range, it's natural for that frequency to decrease somewhat. But here's the key: decreasing doesn't mean stopping. The ideal is to maintain a frequency of at least 12 to 15 ejaculations per month. This can be through sex with a partner, masturbation, or a combination of both. Now, for men over 60, 70, and even 80 years old, and I have many patients in this age range, the recommendation is to keep your sexual life active according to your individual capacity and desire. If you can and want to ejaculate daily or every other day, excellent. If the frequency is 2 to 3 times a week, that's also great. The important thing isn't hitting a specific numerical target. It's keeping your prostate active and healthy. Let me tell you about a real case from my practice. I had a gentleman, I'll call him Robert, a retired firefighter, 67 years old, who came to see me worried because his friends had told him he should stop those things at his age. Robert was genuinely concerned, thinking he was doing something wrong. After examining him and seeing that his prostate was perfectly healthy, I explained this whole Harvard study to him. And you know what he said? He laughed and told me, "Doctor, you're telling me I was doing everything right this whole time?" Exactly, Robert. And here's what's even more interesting. In his last PSA test, his levels were excellent for his age. His prostate was healthy, with no signs of inflammation or concerning enlargement. Comment below where you're watching this from, because I see men from all over the world dealing with exactly these same concerns. But attention, because here comes an important part. Although regular masturbation is beneficial, there are some warning signs you need to know about. Situations where you should seek medical attention. If you're experiencing pain or discomfort when ejaculating, that's not normal. It could be a sign of prostatitis, inflammation of the prostate, or some type of infection. Don't ignore this symptom. If you've noticed blood in your semen, this also deserves immediate medical attention. Most of the time, it's nothing serious, but it needs to be investigated. If masturbation is interfering with your daily life, your relationships, or your responsibilities, then we're not talking about physical health anymore. We're talking about potentially compulsive behavior that needs professional help. And here's something many men ask me about. What if it takes me a very long time to ejaculate? Sometimes I try for a long time and can't finish. This is a phenomenon called delayed ejaculation, and it can have several causes. It could be a side effect of certain medications, especially antidepressants and blood pressure medications. It could be related to hormonal levels, mainly low testosterone. It could be psychological, related to stress or anxiety, or it could be a neurological issue. If this is happening to you, don't suffer in silence. See a urologist, a doctor who specializes in male sexual health. There is treatment, there are solutions. Another important topic that few doctors mention, some prostate medications like tamsulosin can cause what we call retrograde ejaculation. This means that instead of exiting through the penis, the semen goes back into the bladder. It's not dangerous, but it can be disconcerting if you don't know what's happening. If you're taking this type of medication and you've noticed that ejaculation no longer occurs or the volume has decreased significantly, talk to your doctor. Sometimes the dosage can be adjusted or the medication can be changed. Now let me talk about a situation that's also very common. Men who have completely stopped having sexual activity, either with a partner or through masturbation. Many ask me, "Doctor, I'm 67 years old. I don't masturbate and I don't have sexual relations. Am I harming myself?" Look, I'm going to be very honest with you. If there's no sexual activity at all, your prostate isn't receiving that regular cleansing I mentioned. This doesn't mean you'll necessarily develop cancer, but you're missing out on an important protective factor. Additionally, lack of sexual activity can lead to atrophy of the erectile tissues, greater difficulty achieving erections when you want to, and accumulation of secretions in the prostate that can cause discomfort or inflammation. My recommendation, whenever possible, is to maintain some regular sexual activity, whether with a partner or through masturbation. Your body was designed for this, and keeping these functions active is part of healthy aging. And since we're talking about healthy aging, let me give you some practical tips that go beyond masturbation but work together to keep your prostate in optimal condition. First tip, hydration. Drink plenty of water throughout the day. Water helps eliminate toxins from your body, including those that can accumulate in the prostate. I recommend at least 2 liters per day, distributed throughout the day. Second tip, regular physical exercise. Walking, swimming, moderate cycling. All of this improves blood circulation in the pelvic region. I have patients who are 70 to 75 years old who walk every day and have healthier prostates than sedentary 50-year-old men. Third tip, diet. Include foods rich in lycopene in your diet, like tomatoes, especially cooked tomatoes or tomato sauce. Lycopene is a powerful antioxidant that several studies have associated with prostate health. Pumpkin seeds are also excellent, rich in zinc, an important mineral for the prostate. Fourth tip, Kegel exercises. Yes, men can and should do Kegel exercises too. These exercises strengthen the pelvic floor muscles, improve bladder control, and can even help with erectile function. It's simple. Contract the muscles as if you're trying to stop the flow of urine. Hold for a few seconds and relax. Do this several times a day. Fifth tip, maintain a healthy weight. Obesity is associated with higher risk of prostate problems, including cancer. You don't need to look like a gym athlete, but maintaining a weight within a healthy range makes all the difference. Sixth tip, reduce alcohol consumption and avoid cigarettes. Both excessive alcohol and tobacco can irritate the prostate and increase the risk of problems. Now, a question I know is on many of your minds. Dr. Parker, can masturbation replace sex with a partner in terms of prostate benefits? The short answer is yes. In terms of prostate health, the benefits are practically the same. Ejaculation is ejaculation, regardless of how it was achieved. The Harvard study made no distinction between ejaculations from sex or masturbation. But, and here's an important point, sex with a partner brings other benefits that go beyond the prostate. The intimacy, the emotional connection, the physical exercise that sexual activity provides, the release of feel-good hormones like oxytocin. So if you have a partner and the possibility of maintaining an active sex life with her, that's wonderful and brings holistic benefits to your health. But if you don't have a partner, or if for any reason sex with a partner isn't an option right now, masturbation is a perfectly valid and healthy alternative. There's no reason to feel bad or inferior because of it. And here's another important thing many men ask me, what if I have an enlarged prostate? Can I continue masturbating? Look, benign prostatic hyperplasia, the benign enlargement of the prostate, is extremely common in men over 50. And yes, you can and should maintain regular sexual activity, including masturbation. In fact, ejaculation may even help relieve some symptoms like that feeling of a full bladder. What you need is regular medical monitoring, checking PSA levels as your doctor recommends, and staying alert to symptoms. If you notice a significant worsening of urinary symptoms, see your urologist. But masturbation itself won't worsen the hyperplasia. Now I want to talk about something that's often neglected, the psychological and emotional aspect of all this. For years, centuries even, society has created a taboo around masturbation. Especially for older men, there's this idea that it's something for young people, or that a respectable man doesn't do this. This is absurd. Masturbation is a natural and healthy form of sexual expression. It helps relieve stress, improves sleep, releases endorphins, the feel-good hormones, and, as we've seen, brings significant benefits to prostate health. If you grew up in a generation where this topic was taboo, where even talking about it was shameful, I understand that it may be difficult to change this mindset, but I encourage you to do it. You deserve to have a full and satisfying sex life, regardless of your age. And look, let me tell you something. In my more than 15 years treating men of all ages, I've seen the transformation that happens when they finally free themselves from these taboos and begin to approach their sexuality in a healthy way without guilt. I had a patient, I'll call him Charles, who came to my office at 72 years old, depressed, thinking his sex life was over. His wife had passed away 2 years earlier, and he felt guilty even thinking about sex. He thought he was being disrespectful to her memory. After several conversations, exams that showed he was physically healthy, and a lot of work to deconstruct these limiting ideas, Charles began to accept that it was normal and healthy to have sexual desires. He came back a few consultations later with a smile on his face and thanked me for helping him feel alive again. So if you're going through something similar, know that there's nothing wrong with you. You're not being inappropriate or inconvenient or anything like that. You're a human being with physical and emotional needs, and these needs don't disappear just because you've passed 60, 70, or 80 years old. Now let's recap the main points I want you to take from our conversation. First, regular masturbation does not harm your prostate. On the contrary, the Harvard study showed it can reduce the risk of prostate cancer by up to 33%. Second, the ideal frequency varies according to age and individual capacity, but maintaining regular ejaculations, whether through sex or masturbation, is beneficial for prostate health. Third, pay attention to warning signs: pain when ejaculating, blood in semen, extreme difficulty ejaculating. Seek medical help if necessary. Fourth, combine masturbation with other healthy habits: physical exercise, good nutrition, adequate hydration, and Kegel exercises. Fifth, free yourself from taboos and shame. You deserve to have a full and satisfying sex life at any age. And look, I know there may still be doubts, concerns, or fears. That's completely normal. But the first step is information, and you've already taken that step by watching this video all the way to this point. If you recognized in yourself some of the fears or concerns I mentioned, if you have questions about your prostate health, or if you simply want to make sure everything is okay, see a urologist you trust. Don't let shame or fear prevent you from taking care of your health. And remember, taking care of your sexual health is taking care of your health as a whole. The prostate is just one part of your body, but it's connected to your quality of life, your self-esteem, your vitality, and your overall well-being. You have the right to feel strong, confident, and completely alive, regardless of your age. You have options, you have control, and you have access to quality scientific information that can make all the difference in your life. If this type of content helps you, subscribe to the channel, because here we talk about what almost no one explains with clarity. During my more than 15 years of medical practice working with thousands of men, one thing became absolutely clear to me. Most men didn't have real health problems. They had a lack of information. They needed someone to finally speak with them honestly, directly, and respectfully about these topics. And that's exactly what I set out to do, because I believe every man deserves access to correct information about his health, without judgment, without taboos, without shame. So, take care of yourself, be kind to yourself. Accept that having an active sex life, including masturbation, is part of healthy and happy aging. And above all, remember, you're not alone in this. Millions of men around the world are living this same experience, having the same doubts and the same fears. But now you have information, and information is power. The power to make conscious choices about your health, the power to live your life without guilt or shame, and the power to age with dignity, health, and vitality.